Hello, Anne.
Hi, Simon.
It's lovely to see you.
You too. Thank you for inviting me
Well,
today.
it's great to speak to you. Anne Biggs, you're a matron for all of the paediatric clinical nurse specialists at North Middlesex Hospital. Could you just tell us a little bit about your day-to-day workload and what you do at the hospital?
So I am still in the window where I think I can say I'm new to this role. So I started this role in July last year, and I manage a team of 14 fabulous paediatric clinical nurse specialists, including the allergy nurse specialists, asthma, epilepsy, oncology, HIV, diabetes, and sickle cell. And I also manage the paediatric community nurses. And my day to day is lots of meetings. We are setting up a brand new paediatric hospital at home service, so that takes up a lot of my time. And I do visits. I still practice clinically 1 day a week with the children's community nurses and go and do visits in patients' home, provide nursing care in patients' home.
So you're an expert in allergies and see an awful lot of children and their parents and others as well coming into the clinic. What's motivated you to get into allergies? What motivated you to get into that kind of specialist area of nursing?
So before I started this role, I was a paediatric allergy nurse specialist for 7 years, 6 years, sorry. Um, and before that, I was a children's community nurse for 7 years. Um, so while I was a children's community nurse, I was doing lots of home visits and seeing lots of children in the community with poorly controlled eczema, where parents suspected that they had food allergies. And at that time, we didn't have anywhere to signpost those families to. And I also didn't, I felt ill equipped to see them, not having the knowledge of managing how to treat their eczema
Mm.
and how to manage suspected food allergies. So I began to upskill in how to support those families. And something I don't share often in clinic is that actually, as a child, I had really severe eczema, poorly controlled asthma, and I live with food allergies. So I think that gave me an added layer of empathy, seeing children suffering with eczema, having some understanding and insight of what it feels like living with severe eczema or poorly controlled asthma. Um, so I began to audit the caseload and began to talk loudly in front of the consultant colleagues and to the senior leadership team that we didn't have an allergy service, and then was delighted that we had a fabulous consultant, Dr. Delbir Sohi, joined us in 2015, and she fought for funding for the allergy service. And the passion that I had for these children being able to access support and advice for their food allergies, eczema, asthma, I think made me perfectly placed for being successful in applying for that role. And I was one of the original team members to set up the allergy service here at North Middlesex back in 2015. And I absolutely loved the job, the role, the service, the patients, the families for the last 6 years. It was an amazing job. Yeah.
And how have you seen the service evolve since that time? I'm sure it's changed enormously.
It has evolved hugely, and I have to say it's an incredible MDT, and it really is an MDT approach. So the team.
MDT being
Oh yes,
multidisciplinary
yeah,
team.
yes. So it's a whole team approach. So the team is made up of allergy consultants. We have GPs with a specialist interest in allergy who come and do some clinics with us. We've got dietitians, allergy nurse specialists, and psychology team. The team's evolved massively. We are the busiest speciality in our hospital, and we're based in North Central London. It's evolved enormously. We started our community allergy clinic sitting in a GP surgery. Those GP clinics, I want to say, have doubled. The consultant clinics have definitely probably quadrupled, and the nurse-led clinics now run independently. And actually, there's a nurse-led allergy service where we see patients entirely independently. So it's evolved the volume of referrals, the number of clinics that we offer, and also the services that we offer. So we run training days for health visitors, school nurses, GPs, to ensure that families can get advice and support at the first point of contact. And we also run teenage group education sessions, because we know that they're our highest risk age group, and they are also more likely to take advice from each other than us in clinic. We're less relatable to them. So we have those sessions run by a patient who has left and is at university. So we try and get those sessions run by peers, so that the information is coming from someone that's also relatable to them. So yeah, the initiatives that we've done, the services that we offer now, and the volume of patients that we see has grown exponentially. It's a phenomenal team as well.
And what sort of things do they talk about in those groups? I mean, I can only imagine and cast my mind back many, many years of how I was when I was a teenager, which no doubt is vastly different to a teenager these days. But I'm sure, about being singled out, the nervousness around eating out, socializing, those sorts of things.
So we talk a lot about being courageous and ensuring that at least one of your friends knows you have food allergies, that your friends know that you've got an EpiPen or an auto adrenaline injector. They don't necessarily need to be the people that use it, but at least if they know that the people with food allergies have got one, then they can signpost an adult to it, or when they're phoning 999 on behalf of their friends. We talk about sharing, being courageous and telling your friends. And I think actually socially and culturally that has shifted and improved with the media. It's more talked about, has a bigger platform. So I think there's a little bit more understanding and acceptance now around living with food allergies. So we talk about being brave and telling your friends. We talk about high risk scenarios, so drinking, kissing, sex. They are, so I'm trying to think of some specific questions. It's really, they're really engaging sessions. We use tablets and devices so that they can ask the questions anonymously. A lot of it is about going out.
It's about being
going out and
socializing, I
alcohol.
would imagine,
Yes,
and I
yes,
think, Anaphylaxis UK, we try and put across this positive you can attitude that encourage people. You can go on holiday, you can go out, you can go to
absolutely.
restaurants, you can socialize, and and I would imagine, those are the sorts of important things, everyday things that people just want to do.
Yes,
And very often about the reluctance that they don't want to go to a restaurant because they're nervous about, how they might be served and so on. Again, something that Anaphylaxis UK is trying to address with many of the restaurant chains. But overcoming that anxiety it's a big step.
yeah, absolutely, Simon. And at those group sessions, we have a psychologist who comes and does a session with them as well, and talks about managing anxiety and risk, which is always received really well. But it's absolutely about all of our teenagers and young people living their lives the same as anybody without food allergies, that it
Yeah,
doesn't disrupt or impact
yeah.
any of the choices or things that they choose to do. And being confident to be able to speak up, like you said, in restaurants, being able to confidently share that they've got food allergies and ask of the restaurant what they need of them. Yeah.
You mentioned there as well about GPs and having that advice and support at the very first point of contact with a health service, and you've got quite a few, by the sounds of it, GPs with a specialism in allergies. Outside of that kind of health setting, um, what are the sorts of things that people could do to help get, obviously Anaphylaxis UK is here to help with lots of the online information. Um, the waits between GPs and allergy clinics being often longer than perhaps they ought to be, or I mean, they are what they are. What are the sort of measures that you would advise people that they can take?
So from a GP, do you mean from a GP's perspective or a patient's perspective?
From a patient's perspective.
Yeah.
Mm.
Um, so from a patient's perspective, I think there is an enormous amount of misinformation out there. Even I was trying to refresh my memory with some fantastic studies that have gone on to the psychological impact of that of living with food allergies. And even as I was looking for the article that I wanted to find yesterday, there's a wealth of misinformation out there on websites. So I would say to families and patients, if they are suspecting food allergies, I would say, first of all, to when you're beginning to look up the information that you want to find, to go to reputable sources. So such as yourselves, Anaphylaxis UK, Allergy UK. So to go to reputable sources, and your charities are fantastic because also there's phone numbers for some advice. And then it would be to have, if you are suspecting food allergies, to go and see your GP first, but also begin to look at what's your closest food allergy service. Yes, so that I think would be very first steps. There's also Eczema UK and Asthma UK. So it would be to ensure that you're looking at a reputable information online. And that will help guide you with what you need to ask the GP, or what you can discuss with your GP that you think you yourself or your child or young person might need as first steps, I think.
Mm. Certainly, but the fact sheets, all of the information, the
Yeah.
videos that Anaphylaxis UK has got was something that I'm hoping that people do turn to as that trusted source, because they are rigorously checked and double
Yeah.
checked and triple checked by clinicians and many others to make sure that they're right. But so it's in an ideal world then. How would you see your service there developing? But also, what would you advise people, perhaps if you're able to or willing to even, on developing their services elsewhere that just can give people greater access, I suppose,
Yeah.
to a similar sort of services that you're offering there?
So we talk lots in the allergy community and about the unmet need. So it's widely recognised in research that there is a whole population of patients that are not able to access services. Services are inequitable. They are different in different parts of the country, and they have really long waiting lists.
Mm.
So that's recognised nationally, and there is lots of work nationally trying to address that and improve it. And nationally, investment in allergy services will support addressing that. But I think what's really important, and what we are focusing on here in North Central London, is making those services local to the patient and easily accessible with a short waiting list. And I think some of that is about having those allergy services. I would love for allergy services to be based in GP surgeries and like a roving clinic around different GP surgeries in within the borough. That also enables collaborative working and shared learning. So it also enables opportunities for the GPs, the health visitors, all of the primary healthcare professionals that are going to see these families, be the first point of contact for these families. It enables opportunities for that collaborative working and shared learning so that they then also can start treatment at the first point of contact. Yeah, so well-resourced allergy services closer to the patients. Yeah, because we
But
know that the impact of living from food allergies, particularly in the area that we live in, so we know following a free-from diet can be up to 159% more expensive. And then we know families with low income, particularly in the cost of living crisis that we're in, these families travelling to hospital appointments, missing time off work, it impacts them enormously when they're already suffering with further health inequalities just because of the cost of living crisis. So care closer to home is really, really important.
and you're doing a brilliant job. Your team is
Oh, God.
fantastic. You're
I was gonna say it's
fantastic.
not me, it's
There,
the phenomenal
the
allergy
whole thing.
services that are out there, and truly the allergy service here is amazing. So I actually can't take credit for any of it. It really is the allergy service here, the allergy nurses that we've got, the consultants, the dietitians, our psychologists, our wonderful GPs, health visitors, and school nurses that engage with us fabulously. Yeah, so it's a whole army of healthcare professionals out there that are doing amazingly.
It's been an honor to speak to you. It's fascinating to hear how the service has developed, about your role. I'm enormously grateful for you to take a bit of time out today and have this important chat.
My absolute pleasure. Thank you so much, Simon. Thank you.